When some people hear about climate change, they think it is entirely an environmental issue. However, there are very real concerns that the rapidly changing climate affects our very health, as the Dean of Makerere University School of Public Health, Professor Rhoda Wanyenze, elaborates.
I think there are many effects. Some are direct. Excessive heat can harm people and their health and well-being, but also we know that there are other effects like the flooding and the slides, mudslides and others. We've seen that can directly harm health, but there are also indirect effects that come through affecting the ecosystem.
The World Health Organization has declared climate change the biggest threat to health in the 21st century. The impact is seen in how health systems have been affected, including the washing away of Kilembe Mines Hospital in Kasese by floods in one of the many cases. As part of efforts to address the challenges, Uganda committed to conduct a health vulnerability and adaptability assessment during COP26 in 2021 held in Glasgow. The results from the assessment, conducted in September 2023 in over 700 health facilities across the country, show that 48% of these units struggle with drought, 40% are exposed to floods, and 31% to storms.
Majority, nearly 50% of the health facilities were affected by drought, that is water stress. The other extreme event that affects them are floods. Floods were ravaging, destroying infrastructure and making it difficult for health workers to do what they have to do, and even for the communities to access the health facilities.
Health is the human face of climate change. As the world warms, vulnerable communities in Uganda and across the region will continue to face escalating health risks, including increased incidence of vector-borne diseases such as malaria, and health crises like cholera and other diseases which are exacerbated by droughts and floods. At the Rockefeller Foundation, we are committed to supporting Uganda just as we have throughout our 70-year partnership in public health.
Uganda is signatory to several conventions, including the UN Framework Convention on Climate Change, the Paris Convention, and the Kyoto Protocol. And as a signatory to these legal frameworks, Uganda must work within the existing legal frameworks together with the global community to address the impact of climate change. Moving forward, any construction is made to withstand the impact of climate change. In addition, Uganda will move forward to address the issue of greenhouse gas emissions by introducing solar lighting and solar refrigeration where applicable. This will also go a long way in addressing the issues of climate change.
Before, I think we were just observing, but now we want to be actively involved. Why? All the factors of climate change, everything negative comes back to us. We are the end recipient. We can no longer abdicate these duties to other entities, but the Ministry of Health must be at the forefront to mitigate. First of all, we thank the team that did a vulnerability assessment, and now it gives us better understanding of the areas, even to the predictability, to give us the capacity to predict where we are prone.
The officer in charge of the World Health Organization in Uganda, Dr. Christine Musano, says climate change has far-reaching effects on health, including increasing disease burden, food and water insecurity.
Just an environmental issue. It is a profound threat to our health, our well-being and development. Its impacts are already being felt. The rising temperatures, unpredictable rainfall, and extreme weather events that we have been witnessing of late are exacerbating health challenges such as the spread of diseases, food and water insecurity, and the strain on our health systems.
But what is the implication of the study's results? With findings of the study conducted by the Makerere University School of Public Health with support from the Ministry of Health, World Health Organization and Rockefeller Foundation, the Ministry of Health has now developed the Health National Action Plan to build a climate-resilient health system.
It is both a global commitment, but it's also a national commitment that us, as the Ministry of Health, working with our sector-line ministries and development partners, we have come up with a plan, what we call HNAP, Health National Adaptation Plan.
The focal person for climate change and health in the Ministry of Health, Didakas Namanya, further shares some insights into the study findings.
The HNAP is crucial for providing a systematic way of planning and responding to climate change impacts, looking at the health sector and other related sectors to the health sector.
We've seen, for instance, the unprecedented increases in malaria cases. We've moved away from declaring it as an upsurge to now an epidemic. And the malaria burden is largely due to climatic conditions that are changing.
To better manage health emergencies and put Uganda back on a path to achieving the Sustainable Development Goals, health systems need quality infrastructure, resilient supply chains, and workforces that are equipped with the latest advances in policy and practice, as the experts share.
If we're not prepared, it means we are going to experience more and more calamity in the years to come. And that certainly will translate to more health outcomes, things like increased disease rates.
We expect that the ministry is going to work on updating the preparedness and response to disasters related to climate change and health.
So the plan will go a long way in ensuring that we build a resilient health system that is going to change the current landscape.
If we look at our National Climate Change Action Plan, we are talking of a whole of society approach to addressing climate change. What does this mean? It means we are bringing on board the government, ministries, departments and agencies. We have to bring on board, and they are already working in the private sector. The private sector is doing a big role.
Yes, we can leverage the HNAP by firstly advocating for policy integration. That means using this HNAP to push for the inclusion of climate resilience in national and local health policies, emphasizing its importance in protecting public health.
The desired goal of enhancing Uganda's health system resilience against climate change will require multi-sectoral collaboration, and one message from all the experts is clear: our actions today will help protect future generations from consequences of climate change.